It's another day in which I'm not right about to drop dead despite being prone to infections. So I've made a bunch of mukbangs. I've made a bunch of vlogs. My videos are terrible. I have 0 subscribers on YouTube. What that also means is that I can't be canceled because you can't subtract from 0 unless I just get like my whole account deleted. So I thought, you know what? Let's do something different. Instead of a mukbang or a vlog, what if I make a roast? What if I make the 2-year pandemic anniversary special, primary immunodeficiency patient reacts to 2 years of a pandemic? And it's just going to be a roast because I don't have much good to say about it. The media acts like we're all Forrest Gump and we're just like unbreakably loyal and optimistic and positive towards everyone and everything, even when it's like a total clusterfuck, basically. It's like, I'm not Forrest Gump. Certainly not towards the medical establishment because, you know, do I have my textbook here somewhere? Yeah. I took medical sociology in 2015 when I was finishing my degree because I thought they were corrupt enough back then between pharmaceutical industry stuff, agriculture stuff, suppression of medical marijuana, the list goes on. So it's like, who better to make a video on this? So I'm going to step on everybody's feet. I don't care who gets upset. I have 0 subscribers, so I can't lose anything. I'm not too scared to make a video that might ruin my life. Whatever. So, yeah. 2-year pandemic reaction special. What does someone with a primary immunodeficiency think? Probably not the same thing everyone else thinks. I would imagine we're just as divided about what should have happened as everybody else. That being said, here's my take on it. So, 50,000 people a year in America approximately die of pneumonia. The flu varies a lot season by season. It could be 20,000 deaths. It could be 60,000 deaths. 3,000 people die of food poisoning. Mostly, it's old and sick people. It is not typically the healthy 20-year-old cashier who dies of pneumonia. Sure, it happens sometimes. Let's get real. Most of the time, it's not. So, the health establishment doesn't seem to be terribly moved when we die by the tens of thousands every single year, year after year. No need for paid sick leave. No need for accessibility concerns with ventilation and crowding. No need to clean frequently touched surfaces. It's just the old and sick people dying by the tens of thousands every year. And then comes along COVID-19. Brand new virus killed 1,000 healthy, precious people like that. Let's shut down the whole world. It's for the vulnerable. Wait a minute, what? Oh, protecting the vulnerable has always been our top priority. That's why we just started cleaning frequently touched surfaces. It's like, actually, if you really cared about us, you could have cleaned frequently touched surfaces like decades ago. Could have had paid sick leave decades ago. Could have like had any sort of accessibility concerns with ventilation and crowding decades ago, if you actually cared about us dying by the tens of thousands every year. But if you're not moved by that, and you're only moved by 1,000 healthy people dying of a brand new virus, maybe you're not really protecting the vulnerable. Maybe you're looking out for yourselves and you're scapegoating us. So my very first impression right at the beginning of the pandemic, before they really had a chance to do anything, was like, this is fake. Like, you're not motivated to protect us. Like, you're looking out for yourself. Something's going on. You don't care about us dying by the tens of thousands. Now, all of a sudden, you're our best friend. I don't believe it. So, I thought they were repeating the same scam as the war on obesity. Pretend like you're rescuing someone. Really just scapegoat them for everything. Don't help a damn bit. 2 years into it, I can confirm they haven't really helped a damn bit. So here's the thing. If all they're going to do to protect the vulnerable is tell us to put our lives in the hands of a broken honor system, do they really need to be a livelihood czar and a First Amendment czar to do that? So in ethics, it's not considered benevolent to conduct research on a specific group of people who aren't specifically benefiting from the research. So why is it considered ethical to specifically propagandize our health problems if you're not going to specifically protect us? It shouldn't be, in my opinion. I think it's a benevolence issue. So they keep using us as propaganda. They're not doing a damn thing to help us. So anyways, now it's like 2 years later and they're talking about how they're going to get 400 million masks, K95 or N95 masks, and everyone in America can get 3 masks. That's good. Like, I want everyone to have masks, good masks that actually work, not someone's t-shirt put over their face, like an actual good mask. That's good. Shouldn't have taken 2 years to get to that point. And it is kind of a screwed up way to get to that point where they propagandize protecting us over and over and over again. And then are they going to like try to get us the masks as soon as possible? No, everyone gets them at the same time, irrespective of health risks. Well, if everyone's going to get the masks at the same time, irrespective of health risks, why aren't you equally propagandizing us? So that's a little screwed up. So if they really wanted to protect the vulnerable, we could have had paid sick leave as a country decades ago. 94% of the world already does. Accessibility concerns like ventilation and crowding and all of that stuff could have been addressed. Maybe destigmatizing illness, where there's people who think immunodeficient people are all right about to drop dead anyway, so who cares? And it's like, that's not reality. That's Hollywood. So that's an issue pretty specific to us. And yeah, so my opinion is that we're in advocacy debt. Like, whatever blind people had to do in order to, you know, have Braille on elevator buttons, whatever people with walkers and wheelchairs had to do to get elevators and ramps, we're going to have to do the same thing for ventilation, crowding, and whatever. But the advocacy foundations and illness foundations who are supposed to be advocating for us don't seem to think that's important. They think they're doing a very good job. I've written them letters. I've made my very first TikTok about how dissatisfied I was with the lack of advocacy and how half-assed they've been. I think it's pretty obvious, like, this pandemic response has been a complete apocalypse, but it's good enough for the peasants. No need to cover more bases for advocacy, but it's not good enough for us, so we'll just work remotely as much as we want. And it's like, you cannot be serious. Like, you can be a coward or you can be an advocate. You can't be both. So that's been a load of crap. So basically, the health establishment has been fake as hell. They're using us as propaganda, not protecting us. I knew that from the immediate beginning. And then the advocacy foundations and illness foundations are like hiding in a bomb shelter, but the peasants can deal with it. Definitely don't like that. And then the CDC themselves, the way they revised their mask guidelines in 2021 was completely illogical and premature. They can't blame that on anyone. They can't say it's the politicians' fault. They can't say it's the media's fault. It is entirely their fault that they were being illogical and trying to make this honor system like the people who are unvaccinated are going to wear a mask, and then the people who are vaccinated aren't going to wear a mask when there's no enforcement or consequences of any sort. It's kind of like gun control logic. Like, if you ban guns, a criminal won't kill you. I think they would. So if someone didn't care about the CDC guidelines and they didn't trust the health authorities, all of a sudden they're going to start listening to it? Really? They're not going to. And then, of course, 2 months later, they had to revise it again because of Delta. They can't blame that on the media, and they can't blame that on politicians. Like, that was 100% their fault. Again, they've revised their guidelines for quarantining after getting sick and whatever. I don't remember all the details. It was clearly economically driven. Why did they only care about ruining the economy now? Why didn't they care about ruining the economy in 2020? Could it have anything to do with the midterm election coming up? That's probably going to be a bloodbath. So The CDC is corrupt. The health authorities have been corrupt. I think that the illness foundations are corrupt. I don't think there's anyone in power who genuinely is looking out for our interests. There's false friends who will propagandize us and then write manifestos to get as many people as possible to risk spreading a pandemic. They're not friends. They're fake as hell. Ableism and ageism are injustices. You cannot risk spreading a pandemic to promote justice. It's not possible. You can maybe pretend like you are, but you're really ableist and ageist. You can expedite political agendas, but you can't really promote justice by being ableist and ageist and risking spreads of pandemic. That being said, if the living experiment turns out that, it doesn't spread in a crowd outdoors, shouldn't the health authorities be in a rush to try to reopen as many things as possible outdoors and just require masks? But they didn't. That would have been the logical thing to do. Well, you said it doesn't spread in a crowd outdoors. Why not reopen everything outdoors? Wait for the vaccine. Why? If it's good enough for you, why isn't it good enough for everyone else? So that made all sorts of people who might have wanted the vaccine skeptical and not trust it because it looked like it was being used as a political tool. So basically, they've tainted the vaccine with political hypocrisy. It's to the expense of people who are mostly old and sick because, once again, a healthy 20-year-old cashier is not as likely to die if infected than an old sick person. Look it up. 80 years old and older is the highest risk group. So basically, I'm stepping on everyone's toes. I don't care who I get angry at me. I can't be canceled if I have 0 subscribers. It is what it is. I don't know if I have anything else to say. I felt like just winging this video. I didn't feel like writing it all down. I have a notepad right here. I just wasn't feeling it. I decided to just wing it. So let's see. Covered the CDC being screwed up. Covered the health authorities being screwed up. Covered the hypocrisy. Yeah, like, I don't know. That's about it. Be good to your mucous membranes. Peace out. Bye.